Ventilator mode classification, breathing patterns. This lecture was adopted from the following journal article. Breathing patterns. Breathing patterns is comprised of two components which was addressed in other lectures. One is breath control variables and breath sequences. Here's just a little review. There are three primary breath control variables: volume, pressure, and dual control. The control variable is defined by what remains constant when the ventilator experiences changes in the respiratory system. The ventilator can only control one variable at a time during inspiration. However, it can switch variables during a single inspiratory phase. There are three breath sequences: continuous spontaneous ventilation, continuous mandatory ventilation, and intermittent mandatory ventilation. With the CSV, all breaths are spontaneous, which may be assisted or unassisted. With CMV, every inspiration is a mandatory breath with a fixed inspiratory time. IMV, they're comprised of mandatory and spontaneous breaths. Additionally, newer ventilators may incorporate an open breathing system, which allows for unhindered spontaneous breathing within mandatory breaths. Now, breathing patterns. There are 8 distinct breathing patterns. There is volume control, continuous mandatory ventilation. There's volume control, intermittent mandatory ventilation. There's pressure control, CMV, pressure control, IMV, and pressure control, continuous spontaneous ventilation. Additionally, there's also dual control CMV, dual control IMV, and dual control CSV. First, VC-CMV. All breaths are mandatory with the operator selected tidal volume and flow rate or inspiratory time, depending on the ventilator. So here is an example of volume control CMV, and this is my simulator here, and I have a set breath rate of 10. And if we look through the waveforms, we notice we have a fixed inspiratory flow rate for a fixed certain amount of time. So I'm just showing that I have a fixed I time right there of 1.2 seconds, and that's based either on an IE ratio setting, a flow setting, or I time setting. And if a patient spontaneously breathes, the spontaneous attempts will be followed by mandatory breaths for that fixed volume or flow for the fixed amount of time. Volume control IMV. Breaths may be mandatory or spontaneous. Mandatory breaths are operator selected tidal volume and flow/I time. And spontaneous breaths may be assisted. So here's some ventilator waveforms, and here's my flow in red and my pressure in blue. So this is volume control, so my flow should be constant. And this just shows you first the constant set rate of the mandatory breaths. And we're going to grade out. And here's my next series of waveform breaths. And as you start to notice, there's spontaneous efforts in between breaths. And here's another spontaneous effort, and you notice that it's a spontaneous breath. However, it's for the patient's inspiratory phase and expiratory phase. It's not for a set inspiratory time or expiratory time. So this is an example of volume control IMV. And these breaths are unassisted breaths. So this would be example of volume control IMV, and the patient is just breathing on top of PEEP or CPAP. And it's more obvious with this set of waveforms, my spontaneous breaths in between my mandatory breaths, and how they look totally different than my mandatory breaths, which were for a fixed volume and a fixed inspiratory time. Next, pressure control CMV. In pressure control CMV, all breaths are mandatory with the operator selected pressure and I time or IE ratio. So here's an example. Here's just a ventilator waveform graphics, and this is just a picture of pressure control CMV, where I have a set inspiratory pressure for a fixed amount of time. And if I have spontaneous attempts, the breaths will be for a set pressure for a set inspiratory time or IE ratio. Now, pressure control IMV. With pressure control IMV, breaths may be mandatory or spontaneous. The mandatory breaths are operator selected pressure, and the I time and IE ratio is constant also. And your spontaneous breaths may be assisted. So this picture shows our ventilator waveforms, and if we look at our pressure waveform, we see a couple things. We see our fixed mandatory breaths for a fixed pressure for a fixed amount of time. If we look at our flow waveform, and we see the flow distortions going on, and you can also see in the pressure waveform, these are my spontaneous breaths in between my mandatory breaths. However, my spontaneous breaths are not for a fixed amount of time. They look totally different from my mandatory breaths. And this patient is actually pressure control IMV, and they have about approximately 5 centimeters of water of pressure support to augment the spontaneous breathing. Now, pressure control continuous spontaneous ventilation. With CSV, all breaths are spontaneous and may be augmented with pressure. Here's an example of CPAP, the most common form of continuous spontaneously breathing. So with CPAP, pure CSV, all breaths are spontaneous, however, they're not assisted. So the patient can set their own breathing pattern, rate. Other examples of pressure control continuous spontaneous ventilation that are assisted breaths are, which is very common, pressure support, automatic tube compensation, proportional assist ventilation, NAVA, volume support, adaptive support ventilation, and pressure support controlled with smart care ventilation or intelligent ventilation. I'm not going to go over these now. I'll be going these over in a different lecture when I talk about control types. Now, with dual control continuous mandatory ventilation, all breaths are mandatory with an operator selected tidal volume and flow/I time until a pressure limit is reached. Then the breath resembles a pressure controlled breath. This video clip shows the PMAX mode in action. What the PMAX mode is, it's a dual controlled mode in Draeger ventilators, which starts out as a volume controlled breath. So as you notice, I have a constant square waveform and a variable pressure waveform, which is in blue. I have a tidal volume of approximately 500 cc's, and it's creating a peak pressure 22. So here's my baseline in gray. It's grayed out to show the contrast. We currently have a resistance of 5, and we're going to change that. And as you notice, that my volume is going to remain the same. The square waveforms for the flow waveform is the same, constant flow, and my peak pressure starts to rise. I have the Pmax set at 35 right now. And what happens is is it will remain a volume-controlled breath unless the Pmax is reached. And as you notice, the resistance changed at 30, and the Pmax has been reached, and you notice the breath starts squaring off. So it's turning into a pressure-controlled breath now. Dual control IMV. With dual control IMV, breaths may be mandatory or spontaneous. Mandatory breaths are operator selected tidal volume and flow/I time until the pressure limit is reached. Then the breath resembles a pressure controlled breath. Spontaneous breaths may be assisted. So this waveform shows dual control IMV. So first, here's the baseline set of waveforms, and you notice it just looks like a volume-controlled breath until the patient starts initiating spontaneous breaths. Now with this series of breaths, or this breath phase, there's starting to be some spontaneous initiated breaths, as you start to notice in the flow and the pressure waveforms. So they're much different than the mandatory breaths. So these are spontaneous breaths, and they are assisted by pressure support. And I'm just going to gray this out to show the contrast between the IEMV breath phase with what's going to be the Pmax, which is going to happen with changes in compliance and resistance. So this next breath series is the breath hitting the Pmax level, or the mandatory breaths, as indicated by this breath shown by my pointer. However, the spontaneous breaths haven't met my Pmax threshold. However, the mandatory breaths have. So my mandatory breaths that started as a volume controlled breath are now pressure control breaths. Dual control CSV. With dual control CSV, the breath starts out as a assisted spontaneous breath. If tidal volume is not met, the breath changes to a volume control breath. And I don't have any slides or pictures or examples of this. In summation, there are two components which define breathing pattern. These are the breath control variable and breath sequence. There are 8 distinct breathing patterns. All modes of ventilation can be identified by a specific breathing pattern.